why the eyes kind of tend to age ahead of um, the rest of the face, and Maeve can give a real. There she is. There she is.
Hi, how are you?
Good, good. Hey, everyone. So this is Dr. Maeve O'Doherty, and she is our wonderful oculoplastic surgeon who has just done so much incredible work surgically on many of you, and many of you might be interested in these surgical approaches. So it's great to get on and chat with you.
Thanks, Dallas. Thank you
Yeah.
so much. And I hear fantastic things about you too.
Yeah. Well, it's we've developed quite a bond, Maeve, and it's we go back and forth. We do a lot of the same things, but I would reference you every week, if not every day, just about the things that need to be cut, really.
Indeed.
Um,
Well, there's a new the new term BBL now doesn't refer just to sight on lasers and Brazilian butt lifts. It refers to the blepharoplasty brow lift.
oh,
So
very good.
it's been coined a new term, BBL.
It's good for SEO.
Indeed.
So I did put a little bit of structure together just to kind of guide through it because I guess what we want to go through is there's a lot of things you and I probably do a lot of the same things except you're a cutter and I'm not a cutter.
Mhm.
Um, so it's all things surgical, but then all things laser, and then injectables, and then of course topicals. And there's probably so much more that are just lifestyle factors and genetic factors that we have to consider as the eyes are the windows to the soul.
Mhm.
So I guess the first question that I said we'd cover is just like, why do the eyes age first?
Well, I mean, as you know, and everybody knows, I guess the skin on the eyelid is so thin and it's so delicate, and it's the thinnest skin on the body. Like it ranges from zero point 0.5 to 1 millimeter in depth. It doesn't have as much fat underneath it. It's like, it doesn't have the cushioning. It doesn't have as many glands in the skin that keep it moist. Um, and we do so many things. Our eyes are constantly moving. If you think about how many times we smile, how many times we cry, how many
Mhm.
times, it's constantly moving and blinking, even, thousands of times every day, like hugely important functions that the eye holds. And the worst possible thing that we all do, and I think is the most important thing in preventing aging, is we constantly touch our eyes.
All
We
right.
constantly, I mean, I can see somebody who rubs their eyes a mile away as soon as they walk into the clinic. Their skin has become very crepey, their skin, if and particularly patients prone to allergies. So
Mm.
if you're every morning you get up and your eyes are puffed up or are puffy, that expansion of skin, and as we get older, the elastin in the skin isn't as good as it was. So that
Right.
expansion and that reduction, expansion and reduction is like being pregnant every second day, and as women, we know what happens there. So
I
it's
dodged that one.
so basically it's the same thing. And then, I can see people like they're always like rubbing, pulling at their eyes, all of that. That is for me one of the biggest factors why people age around from touching their eyes. Because everything else we're meant to do. We're not meant to touch our eyes. There was an old adage, you're only meant to touch your eyes with your elbows, which,
Yeah.
we shouldn't be doing.
Yeah. Very few can do that.
Yeah.
Yeah. Okay, and so I guess the upper eyelid, lower eyelid, very kind of different strategic approaches from surgery, from laser, and from injectables. I think there's probably very few that inject over the eyelid. Not that we can't, especially with polynucleotides, we're seeing a bit more injection over the eye as well. Um, and I guess would you say you see more upper blephs than lower blephs, and as on your surgical list?
Yeah, definitely. Upper blepharoplasties are probably much more common, partially because I think it's a quicker, easier, probably less invasive surgery.
Mm,
There's probably also more people doing it in
mm,
Ireland potentially than there are, say, a lot of plastic surgeons and oculoplastic surgeons will do an upper bleph, but usually only some will do lower blephs, and particularly a lot of people, when you do a fellowship, even in oculoplastic surgery, you won't necessarily be shown how to do a lower lid blepharoplasty, because a lot of the time the fellowships that surgeons do are in public hospitals, or so you don't get exposure to cosmetic surgery, and in a public hospital you'll never see a lower lid blepharoplasty performed. However, in a public hospital we will do upper lid blepharoplasties for functional
yes.
problems. So if the lids are coming down so far down over your eyelids that they're covering your eyelids,
Mm,
that'll be a functional surgery. So that will be part of a training, fellowship.
sure.
You would have to be with a person who does a lot of lower lid blepharoplasties in their private capacity for
Mm.
you to get the exposure to lower lids. And probably that's one of the biggest reasons why a lot of surgeons don't do lower lids.
And would you say it's more complicated for the lower lid versus the
Oh,
upper
for
lid?
sure.
Okay.
For sure. Yeah, yeah, for sure. I mean, with an upper lid, generally you're taking skin away. You may be taking a little bit of fat in the medial, but generally you're not debulking the lid of fat in general, because you don't want the eyelid to be hollow.
Sure.
With the lower lids, it's much more complex, because I kind of see the lower eyelids as like a clothesline, supported on either end, but not in the middle. And as we get older, the supports on either end start to become lax.
Right.
So, you can, there are so many different elements. Some people will come in, they'll be just talking about the bags under their eyes. Some
Mm,
people will be talking about the skin underneath their eyes. Some people will be talking about the quality of skin under their eyes. And when you do a lower lid blepharoplasty, it's more about the bags and less about the skin.
sure.
If there's a true, excess of skin, yes, you take that away,
Mm,
but you can't take it away to the degree that potentially you could do on the upper lids, because of the risk of retraction,
mm,
the risk of producing an ectropion and
mm,
affecting the functional level, the function of the eyelid, because you know you really want to do no harm. And there are certain, aspects of lower eyelid surgery that can be surprising, and can give functional issues
mm.
if you're too aggressive, I guess.
And so this leads me to next. So like obviously we both chase the skin of this area with our lasers.
Hmm.
And so I guess distinguishing when you're looking at a patient and you're distinguishing between your surgical versus actually a laser resurfacing is plenty for you. What's the big deciding factor in your head for that?
So it's for me, surgery, it's all I think about the fat. Okay.
Okay.
So the first thing I look for is there some degree of fat prolapse?
Okay.
Because even if there is a little, so generally, if you have, say, a fat prolapse on your lower eyelid, sometimes the skin will crease around that area of fat prolapse.
Mm,
So even if I tighten the skin with a laser, or I take away skin, afterwards the skin will crease around. It's like basically putting a pillow under a sheet. The
yeah.
sheet will crease all around, and no matter what you do to tighten the skin, that crease is going to be in an odd location that's going to make you look tired, or it's going to make you just look different, and not the type of result that you want. So if there's a fat bag, you really have to go after that
Mm,
first. And generally, for the most part, I will try to remove a fat bag from the inside, because that's seen as sort of the more conservative, quicker recovery type of approach.
okay.
There are some patients, however, and where I know that I'm not going to get the result from just going inside the eyelid. So in
Sure.
patients, for instance, with a very long lower eyelid, where have a lot of fat, a lot
Big
of
old
mid
puppy dog.
space. Yeah, exactly.
Yeah, yeah.
You know that you have to make this part of their cheek come up closer to their eyelid
Mm.
in order to sort of give the support, number one, to the lower
Sure.
eyelid, and also the cosmetic sort of look for the eyelid to tighten this part up so
Mm.
that you can actually take a good bit of skin away,
Mm.
knowing that you have the support of this behind that skin removal.
Yeah.
So for somebody who comes, for instance, with loads and loads of skin, I'll always have to do sort of a mid-face lift just to lift this up
Okay.
so that it's the pull down isn't going to be bad. And also when I'm taking away skin, I want to go in this vector. I don't want to
Mm.
go in this vector.
Yeah.
So if I go this vector, this is how it comes down. If I go this way, I'm kind of going more horizontal. I'm less likely to cause pull down of the lid afterwards by doing that. But for the most part, if I'm going in there anyway
Yeah.
and doing a surgery, unless the patient says to me, no, I don't want any scar whatsoever, then
Mm.
I'll always, in somebody over the age of 40, I'll always probably take a tiny bit of skin.
Sure.
And then I often just laser on top.
Mm.
So I'll finish everything and then do laser because um, it's like hemming. I have all these little, little
I know.
ways of
Hey, I love
thinking.
them. I
I
love
have
them.
all these ways of
I'm going to
thinking
use
about
them.
things, but it's like hemming a skirt, right? I
Correct.
can hem the skirt from and take a little bit up here, but I can't take the wrinkles out of the skirt down here by
Right.
just hemming the skirt on the top. I have to hem up here and try and iron out the wrinkles. And the laser is how I use to iron out the wrinkles
Mm.
by just adding that as a third part. Then there are some patients that come in with just kind of bad skin quality, crepiness, not true excess skin. Like when they look at me, I don't look like they have extra skin, but when they smile, yes, they might have a little bit of extra
Poor
skin.
quality skin.
Yeah, those are the ones that are probably more, that's the one that is more appropriate to laser. But I always tell patients, look, you cannot get no lines or wrinkles under your eyes. You
It's
cannot
mobile.
get rid of the crow's feet. These are good lines. These are positive lines.
Mm.
They're not like the angry, worry lines that we have on our forehead. Yeah, I mean, I never associate smile lines with being negative, and I think patients
Good.
shouldn't either. And I try to get people to understand that these are good lines. This is a
Mm.
life well lived. Live with them, enjoy them because
You
they're
have to
better than
move.
these
You have
ones.
to live. You have to
Yeah,
express yourself and be emotional. And no, I agree. Like,
yeah,
just
for
keep
sure.
that natural aesthetic.
Yeah,
Um,
for sure.
so I guess so. Some of the questions that came through during the week, along the lines of under eye bags, is developing something called a festoon. And so festoon came up as a question. It was, pardon me. Um, oh, where is it? She said, "What's the solution?" Oh no, it was mailer bags. Sorry.
Well, mailer
Festoon.
bags and festoons are very similar. A
Okay.
festoon is, so a mailer bag is basically the difference. So sometimes people will come in and they'll hold this part of their cheek and they'll
Yeah.
say, okay, can you get this fat out here and can
Right.
can I get a surgery for that?
Mm.
So the difference between an eye bag and a mailer bag is an eye bag lives right in here, almost like on the area of the bone or just above it, and it
Okay.
bulges out and sometimes beyond it. The malar bag lives in this malar region. It's sort of the junction of where our two cheeks, our medial and our lateral cheek is. And there's a ligament right in here. And you have often see this actually
Yeah.
even in young kids, a very defined ligament. And that means that ligament is like a band that stretches from your skin down to your bone. And it means that sort of this compartment is completely separated from this compartment. So you have all these little channels under the skin called lymphatics, lymphatic drainages, and they're like little rivers that basically wash away our fluid. But this area of the cheek, as I said, isn't really in contact with this area of the cheek. So fluid doesn't have sort of an area that it can go easily through our faces.
Yeah.
So with lymphatic drainage issues or with allergies, we often get a little mound here. And I actually have a tiny bit of a one there. And this area kind of goes up and down. It's not present. Sometimes it's worse in the morning. Sometimes it's often worse on a computer screen, and that's where a lot of people will see it, or in photos. And it's basically just lymphatic drainage issues. Now, when it becomes bigger and kind of gets, as I said, deflated, inflated, deflated, the skin in this area can start to form like a little pouch. And that's called a festoon. So a festoon is really like just a kind of a more advanced version of a mailer bag. The
Okay.
mailer bag is like the milder version, and the festoon is where you end up when the skin just gets lax in this area.
It sounds more severe too. It's like a water balloon that's keeps filling up and stretching out and emptying, and
Yeah,
uh,
and it's really something that we see a lot of now, particularly, having, I think fillers were a big part of causing the development of mailer bags. Now, mailer bags form in people who have never had fillers. It's not just uniformly, as you know.
you see it through
You know,
families.
yeah, it can be genetic, smokers,
Mm.
allergy is a huge factor,
Yep.
and but definitely fillers and the wrong type of fillers, the fillers that kind of sucked in water or were
Mm.
there for years and
Too
just were
superficial.
basically, yeah,
Yeah.
and we're basically just sucking in. And as we age as well, the muscles in this area are not as tight as they were, so they don't like give those lymphatic drainage or those rivers under our skin good enough sort of support to help
Mm.
pump all this fluid out of the way. So I don't know about you, Dallas, but how do you feel about fillers in this area? And if you see a hint of malar edema, do you run a mile?
Well, that's well, absolutely. But I would also quote that I would say no to 3 out of 4 people asking for tear troughs. There's probably a select few where a little bit of volume deep down underneath the that orbicularis oculi muscle can really kind of smooth that transition from the under eye to the nose,
Hmm.
but only deep. Anything superficial, I feel, Tyndall's and misbehaves. And
Hmm.
so Tyndall, for everyone watching, Tyndall is when the filler is too close to the skin, it kind of gives a bluish discoloration under the eye. In fact, I had someone in recently who had some teardrop filler done about 10 years ago. And immediately, she was new to me, but the first, when she was asking about her under eye area, whether it's, lasers, is it surgery, is it something? I said, well, actually, the first thing is probably going to be dissolve because there's a bluish discoloration that looks far wider than vein. And she goes, oh, but it's been 10 years since I've had anything put into my eye. And we can see fillers really hold the longevity. That the
Hmm.
full initial volume's likely not there, and it's been metabolism broken down, but there might still be 10, 20, 30% of it, and that's the stuff that's causing the trouble.
Hmm.
Um, and
And
so,
often patients actually can't don't remember either. Like they
yeah,
often, I can see filler like from the door coming in the door, and they say, "No, no, no, I never had filler," and they actually genuinely have forgotten because, they've gone to somebody and they've done, "Oh, she did a touch of this, a touch of that," and they don't really remember
yeah.
what it was. And we
Okay.
all do. Like I can't remember all the filler that I've got put in my face either. So I
Not,
mean, it's a long time over, but it definitely stays, and that we do know. And the importance as well of sort of filler, persistent filler in the face, or a lot of or puffiness due to filler, that can give a lot of residual puffiness post surgery. So if I do a lower lid blepharoplasty on a patient and and they're puffy for a very, very long time, more than I would expect, then they've probably had some filler in this area and it's just become waterlogged, and even after the surgery it causes issues.
well, inflammation loves fluid and draws fluid, and
Mhm.
filler loves fluid. It makes sense that it would kind of prolong that process. It's going to hold on to everything it can.
Mhm.
So I guess that makes perfect sense. But which kind of leads me to my next question. And as a team, we try to meet, probably once a month, maybe once every 6 weeks. And we were talking about preparation and all things surgical in one of our recent meetings, and just about skin health leading into any kind of surgery. So if someone's going to have an upper breath or lower breath or facelift or neck lift or all those all scope surgery, and probably with the body it makes sense too. But I think healthy skin is going to have a much more seamless surgical journey. It's going to have a more seamless laser journey, and it's just better overall when we address skin health. And would you say you'd see a difference, particularly with such delicate skin of the eyes? when someone's minding their skin, with eye creams and maybe using retinol within the vicinity of the eyelids as well.
Oh, for sure. I mean, as we know, retinol improves skin turnover, right? So, and anything that's going to help skin turnover and help, healing will be a huge factor. And the
Mm.
other thing that, even in terms of what we eat, in terms of bruising and that kind of
Sure.
thing, this even, we eat a lot of anti-inflammatories naturally. So generally before surgery, I'll say, try and avoid ginger, turmeric, omega-3s, a lot of multivitamins that we don't even think about that can cause extra bruising because they're actually really good for our skin as well as,
Yeah.
leading to bruising. Some patients, a lot of patients ask about Botox before surgery and, should they have or should they stop having Botox before their upper lid blepharoplasty.
Yeah.
So so I say to people that if you're having Botox for a brow lift, so if you're having a Botox just here and just here in order to lift your brows, then I don't want that
Yeah.
beforehand
Makes
because
sense.
that's going to give, if I'm looking at my skin, I have a bit of skin on my eyelid. If my brow is a little higher, no skin. So I'm not going to have anything to take away if I'm coming into the surgery for my eyelids with my eyebrows up here. However, if you are a patient who always has Botox, at 3 months you're into Dr. Dallas, you're getting your full forehead, you don't want anything moving, then have it because your brows are probably where they're going to be most of the time,
That's the
and
new
and
location.
and your
Yeah.
brows are probably not going to be peaky, and they're not going, they're going to be in that sort of low-ish position.
Mm.
So I would say, yeah, then I'm happy doing a bleph on somebody whose brows are in a normal or even in a low position because I can take enough skin away at that point. And then after this, when the Botox kind of wears off and the brows naturally go up a little bit, then you're even going to look better. So that is with Botox. But even, as you said, skin, what looks better is good quality skin after any surgery.
Yeah.
So if and that's generally the reason why if somebody comes in and is having upper and lower lid surgery, but their skin looks, it looks like they have too many layers and I need to pare that layer back. We'll often combine surgery with a halo,
Yeah.
or, they can go and have their halo with you after their surgery, or, so that they can combine two sets of downtime
Yeah.
at the same time. Or sometimes, if somebody wants full field resurfacing around their mouth, because that's quite an aggressive treatment and lip
It
lines
is.
affect so many people. So they have their lower lids or upper lids done, and then they go to you or me, whatever, and do their perioral area
Mm.
in the next day or so, because this isn't painful. My
Yeah.
my eyelid surgery recovery isn't painful, but it is downtime. So you can expect 7 to 10 days downtime.
Mm.
At the same time, you can heal from a perioral resurfacing or a
In 10 days.
halo.
Yeah.
And in actual fact, the laser is going to be the hardest part of it because that can. But the difference it makes to have good quality skin, like in your pre and post op photographs, if you look at somebody who's had their eyelids done and has had a halo or has had their lip lines done, it's
Mm.
incredible.
Oh,
It just like completely changes the whole look. It just rejuvenates, and you kind of go like even the patient is going, oh my God, I didn't really notice the halo, but now I notice it. Or I mean, I had a patient in yesterday, and she said, the worst part was actually the laser around the mouth,
it can
because she
absolutely.
was like so worried about that part that she
Mm.
forgot her eyelids were even done. So, but it's a great time. It's a great way of combining downtimes.
Oh, 100%. I think optimize the downtime.
Yeah,
We're all busy.
exactly.
We've all got things to do, and but that's I guess from our point of view, if you are going to intervene surgically, I know a lot of times you'll laser on the same day, but say if someone is healing and they're looking to get their around their eyes laser, How far after surgery would you like them to wait if it's not done on the day of?
Oh, so you mean they're upper or lowers?
Oh, that's a fair question because the lowers you probably want to leave them alone. I'm assuming
Yeah,
because
yeah.
you
So
don't want
on the
any more
lowers,
contraction.
yeah, the lowers, you see, you're creating a scar. Obviously, if you've
Yeah,
no scar, you could do it the day after. Like it's no problem,
sure.
doing it. But if you have a scar and you want to go right up to that, you're having an inflammatory action straight off the bat from that. So if I do it, I want to do it within on the same time point or
Makes
within a
sense.
day, or else I'd probably leave it 3 or 4 months then afterwards. If I'm doing an upper lid blepharoplasty,
Mm,
you can do your lower lids anytime. It's,
that fire away.
the scar isn't, it's the scar that makes that makes the difference. Um, and then, yeah, you just want to make sure you have lots of icing on afterwards and stuff like
Mm,
that. So you're not creating extra swelling.
okay.
I'm a big believer in trying to keep swelling down as much as possible on the eyelids. Like I'm 10 minutes every hour post surgery I pad patients' eyelids up for after their surgery till the following morning in general. They
Okay.
peek out the corner. And then the following day, it's 10 minutes every hour while they're awake.
Sure.
And you want to, it's this theory in my mind about this inflation, deflation of skin.
Mm,
You want to kind of keep the inflation of this thin skin to a minimum because as we get older, the elastin isn't there to pull it all in afterwards.
mm.
So yeah, so and the same with lasering under the eyes. You want to keep, yeah, icing as much as possible.
And when you're talking about, say, downtime, what in your mind, how much, what's downtime like with surgery? Because I can explain a laser downtime, and maybe I'll do that after you. But when you say 7 to 10 days downtime, what does that include for all those
So it
listeners?
depends. So upper lids, you're always going to look purple, like
Okay.
on the eyelids. Even if there's no bruise per se, the eyelids is so thin, so it looks purple. But that purple look usually lifts at day 3 or 4. So
Okay.
day 1, 2, and 3 are the worst. Day 4 starts to get better. Day 7, you come back for removal of the stitches,
Mm,
and you're going to have a red line. And then once the stitches are out, you're going to have tightness here, but by 10 days, most any bruising is gone. Most people actually don't bruise much, but
yeah.
by 8 or 9 days, you can start wearing a bit of eye makeup to conceal the redness, conceal any residual bruising. Most people probably wouldn't notice you too much. You may still be puffy because you imagine those blood vessels are still leaky under the skin. Just like the skin is
Mm,
red on the outside, inside is red too. So anything you do, like if you drink a glass of wine in those first few days after weeks after the surgery, if you have a salty meal, those blood vessels will leak. So there may be moments on and off in the 6 weeks post surgery where you wake up and no particular reason you're swollen again and you're going, oh, I was
mm,
perfect yesterday. What happened?
mm.
And it's usually that you just had one glass too many. And it's
It's
just
your
because the blood
salt.
vessels, exactly. With
Mm,
regards to lower lids, again, depends. So if I do a transconj approach, which is from the inside with just a skin pinch, again, about 10 days, right?
mm,
But if I do a mid facelift with kind of a lot of skin removal and that type of thing, I say to people that's a 2 week downtime, and probably you won't look right for a month or 6 weeks
okay.
because what I'm trying to do is basically tighten you up and pull you up like this so that when you normalize and when your eyelid wants to contract, it contracts down to a normal position. So I like to start from a higher position. So initially you look a bit avatary, like you look a bit like pulled up on either side. And sometimes if you've taken a huge amount of skin away, you can have a bit of puckering out here where I'm trying to take all of this skin and kind of suture it to a smaller area. So
Sure.
it can look a little puckered. And I just like people just, expect the
Yeah.
downtime, expect a month to six
Ah,
weeks, and then things will settle down. So that one is much longer, the mid facelift, that type of surgery, much longer downtime in terms of perfection. But 2 weeks till you're kind of decent enough, and then laser, so
ah,
you can talk
ah.
about the laser bit.
So yeah, and we like to say in the clinic that if you want to get something, you got to go through something. And like with these minimal downtime, no downtime treatments. You got to keep your expectations low with those. So when we're resurfacing the dives, we use for any of the laser nerds in there, we're using kind of 80 ablative and 50 coag. And that's kind of, and or 50-50, depending on the skin type. And so that's something we're going to walk you through step by step. So when someone's into the clinic, they're in for consultation, and we show like the day one, the day two, the day three, all the way through to about day 10, sometimes even day 14. Because unlike what Maeve does, um, ours is all on show. Ours is all that talk. And sorry, Maeve does this as well. So I should clarify that she's also a laser junkie. But we're creating an open wound, and often we're getting rid of the top layers of the skin, so that epidermis, and then down into the dermis, and we're using a little bit of one form of the laser to give some contraction to the tissue, so you can see some of that tighten up real quick as we're kind of working at a skin level. We do use a little bit of radio frequency from time to time as well, where we might get kind of 2 millimeters or even 3 millimeters into the fat tissue to try to cause a little bit of lipolysis or breakdown of the fat.
Mm.
In very mild cases, we can get some quite good improvement in tightness to that deep layer, and then resurface the skin on top. Obviously, when they're big cases, we're very pro surgery, but
Yeah,
you know,
well, it's interesting because radio frequency is like monopolar cautery.
mm,
So when I'm in there on the inside doing excision of fat from a conjunctival approach, I'm on the undersurface of the orbicularis. So your
mm,
radio frequency is on the outer surface of the orbicularis. I'm on the undersurface of the orbicularis, and I actually use my monopolar cautery just to tip off the multiple little areas of the orbicularis
mm,
to work like radio frequency to kind of form a contraction of the orbicularis, because that can be lax as well, in eyelids. So radio free. In actual fact, I saw you posted a photograph where you did radio frequency for a malar bag or a festoon,
yeah.
and you got amazing results, because I will send you all my patients that come for festoons, because surgically that's a really tricky one. Like, you're not going to get results. So I say, like, Dr. Dallas is your man for those
Yeah.
ones, because
Okay,
that was an
great.
amazing result.
And she was a result, and she's a wonderful individual, and we really appreciate her letting us talk about her and show her images, and there's the tissue's alive, and so she's I saw her maybe in the last month or so, and still we're still like 80% better from where we started, but the nature of the tissue, it needs to continue to be stimulated.
Mm.
It's a luxury that time moves on and that we get to move on with time. But because of that, the tissues will turn over, and there's actually a little bit of return that I probably can just get a little bit of laser back to the area just to maintain the tightness. But the lower, the fatty, more mailer bag kind of area, is still quite taut, which is great to see this far on.
Mm.
And
Well, I
and
love
then
the idea of the Morpheus 8, or the radio frequency for malar edema,
mm,
because I feel like those pinpoint. I don't have radio frequency in my clinic. I do, the monopole cautery or whatever, but I
yeah,
don't have Morpheus 8. But like the actual little, in my own mind, I'm seeing these pin prick
mm,
kind of radio frequency boring into this area and creating columns of contraction under the skin.
yeah.
Because for me, I think that it must be part of the issue of the laxity in this area. I think that's got to help for sure, as long as it's in the right hands, for
Yeah,
sure.
the right hands, not too much energy, but enough
Mm,
energy. And but I think it's also patient selection. Like there's certainly cases where I'd see them, or you know where I just and I send them to you, or I send them as consult, because having that dual opinion where you're kind of going, actually, you know what, maybe non-surgical is enough here, and in 10 years time it might be more of a surgical case.
mm.
And it's and
Well,
we do that with.
surgery is definitely not, it's not predictable in these cases, for sure. The only surgery that might give a bit of benefit is the more severe kind of lower lid left, with the mid face lift and the tightening of all these tissues, because it lifts the mid face and tightens this area. But it's like, but I say to patients it's 50-50. I'm not sure. It may be, it probably won't be worse,
Mm.
but there's a 50-50 chance it's not going to be better. Um, and you can also, if you have like festoons or laxity in the skin, you can also actually directly excise them.
Right.
Now that involves a scar right here, but often, to be honest, if you see post-operative photographs, the scar looks better than the festoon, and then you can laser this area and soften up the scars and that kind of thing. But that's probably, if you have a true sort of laxity of skin there, direct excision is probably a better option, and then lasering scars on top.
Yeah, you have to address the quality after. But
Mm,
I would often say that uh, the a lot of what you're paying for with a lot of these surgeries is how good that surgeon can suture. Like your ability to I'm sure the stuff underneath you can probably get away with a lot, but nobody's ever going to see what's going on underneath. It's the remnants of you being there. How well can
mhm,
you hide that? And I've seen a
mhm,
lot of your cases as they're my clients who have sent to you, and it's just the invisible scars is so impressive. And some of those are above eyelids, so there's not like they're within, the conj. Like
mhm,
your blephs
mhm,
are, or even your temporal lifts are just your
mhm,
ability to suture is what differentiates you um, from someone who's not as good at suturing.
okay.
And it's not. It's a compliment to your work, and
Mhm,
I think that's what people they kind of got to know that's the
mhm.
skill is what's really impressive.
Thank you.
Yeah. I'm trying to think what else have we got. Polynucleotides. Are you playing with polynucleotides?
Yeah, I mean, my nurses usually do those treatments in our clinic, and I think, interestingly, I lasered my own eyelids about 2 years ago, and I used polynucleotides after the in that post laser period where
Mm.
I was red and I was just like slow to heal, and I was getting so annoyed with it,
Right.
and I'm kind of an impatient person to begin with, but
That makes a
but
surgeon out of
then,
you.
so I
Yeah.
got polynucleotides injected, and that really did speed up the process. I don't know if it was kind of at the end stage, and I was going to heal anyway, but I did feel it helps. My issue with polynucleotides is, there are not a huge amount of studies out there saying for sure these work. Like, there's not good placebo trials. I think some patients love them
Mm.
and come back and say they're amazing. Some patients don't see any difference. I think, again, it's patient selection, right? If somebody's
Absolutely.
coming in with a huge amount of laxity and bags under their eyes, you can inject all the fish sperm you want, and
Mm.
you're not going to get rid of that bag or that. But so I think if we're true in and honest with the patient and say, like, look, this is how
Mm.
it is. This might help. We don't know for sure, but anecdotally, a lot of patients find this good.
Yeah.
And you seem to be the right type of person for this, but knowing the patient, that you can say for sure, yeah, it
Mm.
might improve your skin quality, but overall, it's not going to give you much of an improvement.
Well, and I think the thing that differentiates them, and what I think they've been over marketed. Like I love them. I use a lot of them, but I use them very. I would give a lot of education and advance them because they are regenerative medicine. So they are there to kind of tell the cells to behave like they're younger or they're better than they are. And
Hmm.
so I think the risk of harm is very low. But I think you're right. There's going to be some people who have much more dramatic response to this, and there's going to be some who have a less dramatic response. So I think in if we treat them like PRP and other kind of even fat when it's used as kind of oh what's it
Nanofat.
nanofat, there we go.
Mm-hmm.
So when it's used in that way, there's a lot of regenerative properties to it. And, fat has the advantage that there's stem cells within them rather than just mRNA. And then PRP, of course, is full of growth factors and platelet-rich plasma. So fat is probably, in that sense, is probably the superior modality. But then the process of attaining fat is
It's invasive
it's
for sure.
it's invasive, it's expensive,
Mm,
it's
mm,
but it's if there's fat being taken out, I think it's
mm.
absolutely choose it.
So I mean,
Uh,
I use fat in my lower lid blepharoplasties. Just last week I did a patient where you took tummy fat, and the way we take microfat. So
mm,
the syringe we use takes small aliquots of fat and then inject them here. Again, how the lower eyelid looks after an eye surgery is very dependent on how the mid face looks. If the
sure.
mid face is really hollow and skinny and thin, the eyelid looks long, no matter how and the patient still looks tired. So
Mm,
adding mid face in volume in terms of fat at the time, or I often use Sculptra as well. I don't know. Do you use
okay.
Sculptra?
It's funny. I really like harmonica because the
Oh
hyaluronic
yeah.
acid in
Okay.
it.
Mm-hmm.
But I do Sculptra, like I have it for kind of the tummy or
Mm-hmm.
the knees, the elbows, the
Mm-hmm.
kind of off face side of things. And it's just I like the predictability and the less work involved in harmonica.
Uh-huh.
Um, but no, I think Sculptra is a fantastic product when used
Mm-hmm.
correctly.
Yeah, so I mean, I just think mid-face volume replacement is a huge factor with lower eyelid surgery as part. Now, I reposition the fat, so I take the fat from the lower lids and reposition it down here. But even when the bag is pretty big, sometimes, unless you have a good mid-face volume, sometimes it doesn't camouflage the fat you're transposing enough as well. So you have to be careful in a very thin
Yeah,
mid face that you don't actually transpose too much and get a bulge in a different location, so
for
that's
sure.
that is a limitation for that, so you always have to add a little bit of mid-face volume.
The skin is a tablecloth. It
Uh-huh.
shows whatever the lumps and bumps that are sitting on the table. So we even
Exactly.
see that in the lower face when people have missing teeth, especially as they get older. You can see little indentations in the cheek as the skin and the tissues will fall into what the anatomy below it is concealing. So it makes perfect sense. If the fat's too superficial and the skin's too thin to hide a lump or bump, it's going to
Hmm.
show, especially on expression in the mid face. When we bring those cheeks up, all of a sudden you got a little bulge coming out. You'd have to, and it's harder to get rid of fat than it is something readily dissolvable.
Yes, exactly.
Uh, I'm trying to think. Do we have anything else? Crabby eyelids. Someone asked a question there. Our views on full field. I think it was full field resurfacing. Views on full face resurfacing,
Do I do full face resurfacing?
or how do you feel about it?
For the right patient, I love it.
Mm.
But again, I will not do a full face resurfacing with an upper and lower lid bleph. I just feel like it's too much.
That'd be a
It's
lot of
too
doing.
much
Yeah.
for me, and it's also too much. I do all my surgery, pretty much 99% of it under local anesthetic. So I have
Mm.
to be careful with the amount of local and topical, and
Mm.
you have to do a lot of injections in the face when you're doing a full field resurfacing. I will generally just like do an area
Yeah.
of full field resurfacing at the same time, or I'll do a halo at the same time. I'll do a full field on a separate patient. And generally, I'll only do a full field resurfacing on somebody either, I mean, if they've got a lot of skin damage, like a man who, needs like, preventative treatment for BCCs or something, and I can go
Sure.
down a certain level, or in a woman who actually has a lot of sun damage, lines, wrinkles, and that type of thing. It's not for the faint-hearted. Like
Oh, no.
it's a really difficult post-op, and a lot of patients have to be really counseled about what to expect. But it's a very
And
good
you need to hold
treatment
their hand after as well.
for
Like
sure.
it's a big recovery.
Hmm.
I like to consider those kind of ones. As soon as we get beyond kind of 50 microns, so into that deeper surfacing kind of level, I consider that laser surgery rather than just laser resurfacing.
No, for sure, for
And
sure.
I agree. We do a lot more kind of targeted, whether it's just around the mouth or around the mouth and under the eyes. But as far as the rest of the face, other than specific, extensive solar elastosis, those real kind of leather handbags that just it's got to go. And usually, even when you do that, you're gonna have to replace volume in different areas of the face too.
Mm-hmm.
Your
Mm-hmm.
sculptures and some dermal fillers and things like that will play in. Um, but it's I think a more targeted approach with the deeper surfacing. And then Halo has just got us so many incredible results at a fractional. So meaning we're treating part of the tissue, which lowers your downtime, but it gives us that collagen stimulation to that deep levels of your skin to really kind of give you a resurfacing without the huge downtime of a full field where we absolutely mow the lawn and get rid of layer upon layer upon layer of tissue. And you know, I've seen more and more online of but people having deeper surfacing to their neck and décolletage, and that's completely different skin. That doesn't have the structure. I mean,
I'm extremely careful when it comes to neck
mm,
and décolletage, yeah, for sure, and body. I mean, we just don't have the sebaceous glands to support it. Also, of course, patients who've had electrolysis, I tend to be a bit, if they've had years of electrolysis in the past, they may have around their mouth or something like that. I'm
mm,
careful on those as well in terms of causing scarring because, again, they don't have the oil glands or the sweat glands to like support the rejuvenation of the skin afterwards.
absolutely.
Yeah, it's definitely scary stuff and definitely big learning curves when you start doing lasers.
Incredibly rewarding and actually really, really enjoyable to do.
Hmm. Well, I
It's
saw you're doing all your little lumps and bumps
yeah.
and lasering them off. Yeah, it's very
Any
cool.
any chance I have to have my hands on the laser. So any chance it's such an incredible tool to use and
Yeah, and I think,
it's
underutilized for cancer prevention as well. I mean, I think that's really important,
yeah.
particularly a lot of men, a lot of Irish men. You don't actually have to go that deep, just like down to 125 microns, and you have the top layer gone, and probably reduced your risk of skin cancer massively. And because like everybody sees a laser as somehow a cosmetic
Yeah.
tool, but sometimes like these, skin treatments that are given for basal cell carcinomas and or pre-skin cancer, and they cause such horrible skin for a period of months on end when you're stopping them, starting and stopping them. When in actual fact, sometimes if you just had a laser, a downtime of a week or 10 days, and then you've really nice new skin again, and it achieves the same thing as some of these creams do.
Well, and you'll hear our derm colleagues all the time. They'll tell you that that basal cell carcinoma is from a sunburn 20 years before. So
Hmm.
that means you've got that precancerous cell sitting in your skin that
Hmm.
even if you treat at a fraction, so full field, yeah, you're probably going to get rid of a huge, the
Hmm.
percentage wise, it's probably even more. But I believe with the fractional, it's quoted like 30 to
Hmm.
50%
Hmm. Yeah, that was a
reduction in,
study. That was
yeah.
a study with the fractionated as well. Yeah, for sure.
But that the second study there was when they did that on patients with who had previously had a
Hmm.
basal cell squamous cell carcinoma. It reduced their risk by I think they were 30-50% as well. I should pull the exact numbers and put it up on
Yeah, I
Instagram.
can't remember, but I
But
know it was impressive.
yeah, but even if it was 10-15%, that's a
Yeah,
significant number. If you had those odds with the lottery, you'd be playing it like stink.
I know
Um,
exactly. Yeah, for sure.
so yeah, no, like I think the lasers is just an incredible growth and move forward in aesthetics, and we're seeing a decrease in filler, but I think targeted filler use is still really important. It's good to see the overuse and the misuse kind of slowing down at least.
Yeah, for
Um,
sure.
do we have any dark circles? That's always a good one. Dark circles, the bane of many's existence. What causes dark circles?
Well, I mean, for the majority of the cases, I think it's genetic. I think it's obviously racial too in some cases. And sometimes it can be. They say, I don't know that anyone really knows what causes dark circles, but just the blood flow is just a bit slower in the
Sure.
area. The skin, translucent, depends on your skin, very pale, translucent skin, will show everything through it. And, there's a map of blood vessels under our skin. And if, if your skin's thin, you'll see those as well.
Mm.
So, personally, I'm like Sorry. I don't know what to do with dark circles, except if they're hollow,
Mm.
maybe a little bit of filler if they're
Mm.
hollow, very hollow. Polynucleotides, I think, have a benefit. Certainly, one of my nurses, who is Filipino in origin, she likes to use polynucleotides and does find it very beneficial. But other than that, I can't promise anything on dark
Mm.
circles.
And it's you can see them in the young, but it generally is something that comes with time.
Hmm.
And so I think a lot of that, even when it's polynucleotides, if we're using, say Obage's by mineral complex, the elastoserum, which I think is a fantastic under eye serum, but all these things are increasing the strength of the skin, the quality of the skin, the health of the skin. So I think when you increase all of those kind of factors, you're probably going to reduce some of those. Do you use Clear Sweet down there?
Yeah.
Yeah. So and how do you like? We've had more and more. I'm gonna say fun, but let's say
Yeah, I
strategically
mean, I've heard
treating.
it's, I've heard it's, I mean, that you can use it as part of, you talking about the Clear V, using the Clear
Yeah, Clear
V
V,
in,
zapping
yeah, yeah,
vessels.
yeah.
Yeah, yeah.
Yeah, exactly. I mean, you know what? I've shown it, I've known about it, we know about it. I just don't get time to do a
That's
lot of
okay.
treatments that I
Of
really
course.
want to.
Uh,
But I've heard that it's great, but I haven't done it because as you said, I'm cutting away in the in my room.
Absolutely. Slicing and dicing. But so it's been we've had a lot of luck. Well, luck's probably the wrong word, but we've had a lot of really positive outcomes by chasing some of the, especially some of the bigger vessels, our big blue vessels under the eyes in particular.
Hmm.
Above the eyes, we've done a few, and obviously you got to be really careful because the ND laser has got
Hmm.
great penetrating power. So even though when we're doing this, we use kind of metal contact lenses inside the eyes.
Hmm.
We're so careful. Like if anything is kind of um, and nothing can be pointed towards the globe or the eyeball
Hmm.
itself,
Hmm.
and so that can sometimes cause some
But do
limitations.
you use so the Clear V obviously for the blood vessels, which I do use it for, but do you use the Clear V as well for the dark circles? Just using it in a kind of like a wand almost? Because I've seen it used, Dana, for instance, where our trainer when he originally showed us a mode where she, that could potentially help with that. So I just haven't got around to doing it, but it's a modality within that we could use it for.
Well, it makes sense, right? Like
Mm,
um, it's the ND egg is such a multi-purpose laser. Like this, the ND egg can be used for kind of fungus in the toes. Like it's got such a wide range of capabilities. So I guess it's honing the settings and your frequencies and I guess there's the clear silk side of things, which is much more rapid fire and targeted at that superficial layer, which is where we might see a bit more. But I'll have to get back to you on that one.
The
Um,
other thing we haven't discussed, and I get an awful lot of messages about this, is the role of how do I distinguish between a brow lift and a blepharoplasty?
hmm.
People, and this is why the term BBL is becoming so popular because I feel like I have never discussed eyebrows as much as I have in the last year or two. I don't know why. I don't know. Is it because Botox is becoming so mainstream now, and people are sort of probably not allowing their foreheads to recover between Botox, or just years of Botox and the brows are coming down, or even, I mean, people who never use Botox are talking about brows. But I like to explain, just because it's a really common question, is how to decide whether or not someone needs a brow lift or whether
Hmm.
they don't. So my big thing is, I look at where the tail of the brow is, and
Hmm.
I see whether the tail of the brow is kind of in line with the medial brow. So
Okay.
if the medial brow and the tail of the brow are pretty much in line, then that's fine. They don't need a lateral brow lift. Now, I do lateral brow lifts. Full brow lifts are done from the hairline
Hmm.
and are done generally by plastic surgeons. They generally, you know, they're one of my old bosses. I said to him before, how come we didn't do a lot of brow lifts? And he was like, well, mate, they work in the young who don't need them, and they don't work in the old who need them. So brow lifts in general are sort of disappointing surgeries for when you lift the whole brow, because the point of action back here is so far from here that it doesn't do much. And
Yeah.
even if it does, it's often a temporary effect for maybe 6 months or so, and then it kind of drops again. So the brow lift that I love and find the most useful is the lateral brow lift. The
Mm,
downside is it has a little scar here on the brow. If you don't want that, you're not having it,
right.
and that's fine. But most patients are so bothered by their brows that they can say, "Okay, I don't care. I'll just wear a little fringe over it for 6 or 8 weeks until it's
Mm,
gone, until it's disappeared." But so when the outside part of the brow is much lower, sometimes I'll see the outer part of the brow down here and the
mm,
inside part of the brow here, then I'll say, well, the fat pad associated with the brow or this area of the brow is thicker and it's a thick skin. And
sure.
if you don't take that thick skin and elevate it a little bit, the brow will still, the eyelid and the high periocular area will still look
Mm,
heavy. And even though you'll take away skin here, you can only take the thin skin from the eyelid. You can't take the thick skin from the brow because the brow skin is thick. It doesn't roll, it doesn't crease in the same way. So it's a mistake if you try to incorporate sort of brow skin within your blepharoplasty skin. The better
right.
option is to lift the brow a little bit. Yes, it might be a scar, but it's a powerful brow lift. It's a much more powerful brow lift than any other brow lift. And it lifts that whole area out, kind of gives an opening to this whole area. And 6 or 8 weeks, the scar has pretty much disappeared,
Mm,
and you just get that sort of elevation. If the whole of the eyebrow is sitting on the eyelid, then it's either a full brow lift that I said doesn't really work, or often these people are people who've always had low brows. They
sure.
you look you say to them, look, how did you look when you were a kid? "Oh, I think I was always kind of heavy set." You're not going to change that. Some people have a kind of prominent frontal bone that overhangs the orbital area. As we age, our eyes kind of sit back a little bit more, so we get more of an overhang. Orbital structure and kind of an anatomical structure isn't something that can be altered, and it's really important that people understand that. I see patients come in, sometimes they go, "Can you take this away?" And they're holding their eyebrow, right? So it's very important to understand the difference between the brow and the eyelid, and that the two are different surgeries. I just incorporate it as part of the blepharoplasty, and it just does, it just gives a little bit more opening to the eyelid and a better result.
So you're telling me that if you take on one more element of surgery, you could offer three different BBLs in one patient.
Exactly.
So we could do the butt, the brows, and the skin. Like it'd be
But
the
there is no
trifecta.
there is no way I'm going near butts. I tell you that much.
No.
I am staying far away from a butt.
the I think sorry, back to the brow. In all seriousness, like I think, and I imagine that the demographic of patients that's looking for this as largely as changes to the other structures around there. So we often see more hollowing of the temple. So we've got this loss of volume in the structures, and even the bolster or the thickness of the muscles of the frontalis, the strength of the frontalis. There's a lot of factors that can change to cause more crowding of the brows, as well as we see in cadaver labs that the orbits of a young skull are more round, where they become more squared. So that's the bone. So as much as we talk about the fat and the thickness of the skin, it's the bone underneath is absorbing too. So all of a sudden there's a cavity for the skin to fall into, and the fat it wants to go back. It doesn't want to be pushed out. It doesn't want to be structural. It
Mhm.
wants to fall where it can. It wants an easy life.
Sure.
So
It's the sad eyebrow, as I call
uh,
it.
and
Our
I'm
eyebrow
guessing.
is still down there. Yeah, yeah.
I would assume you're not a fan of threads. I'm not overly a fan
You know
of
what? I
threads.
don't mind like the collagen threads, like
Hmm.
just under the skin creating collagen. I just don't get how a thread can lift something that's attached in two places. If
Yeah,
you see, if you look at how hard it is to lift a face or lift an eye, it's pretty hard. Like you have to dissect a lot to get lift.
for sure.
So the thread may give collagen stimulation in
Hmm.
the same way as Sculptra does and lift in that way, but it
Yeah.
doesn't create a true lift, in my opinion. I don't do threads actually because I worry about how to take them out. I'm always worried about complications. I try to try it. If something happens, I don't sleep, so I rather try to sleep.
But and the importance, I guess, the threads Maeve's talking about are kind of they're kind of straight threads, so they're
Mm,
for college stimulation. Whereas others that are used for thread lifting have little barbs or hooks on them, and we don't they when people place them, they don't want them to hook into the skin because that'll cause puckering, and they
mm,
don't want it to hook in deep down to the muscle because that'll affect muscular function, and they're trying to keep them within the fat layer. And what
mm,
I've always struggled with is anytime I've dealt with fat, it's not doesn't have a whole heap of purchase.
mm.
So,
For
unless you're
sure.
fixing one end to another and you have
Mm,
two, a definite beginning and a definite end, like when they're trying to, these one
mm,
stitch facials, you can almost justify them. But then where does the tissue go?
hmm
Which is where I've always struggled with threads. And I think there probably is a cohort of patients that these are really suitable for, but they're never the ones that want them. And the ones that want
It's
them are
kind
the
of
ones who
like,
aren't suitable.
yeah, I mean, it's kind of like Softwave or Morpheus 8 for jowling and things like that. I think for me, like Softwave, we have Softwave, and it is a good device, but it's almost at the preventative. I think the true nature of the true goal of it is prevention and early jowl formation. But the people that want it are the ones where it's gone already, and where it's too heavy,
Yeah.
and then it's more like you're in the surgical sort of sphere of needing that, and otherwise you're just creating disappointment.
Yeah. Yeah.
You know.
Well, I'm trying to think, do I have any more questions? Was there any more questions in there? Uh, Keeping it natural. To comparison, downtime expectations. I think we've covered a lot of things, and I think we could probably pull another hour or two out of this if we really tried, because like it's such a fascinating area of the face. It's that windows to the soul. It's the centerpiece. Oh,
Well,
right.
it's like after COVID, right? I mean,
Mm,
during COVID, eyelid surgery, I think that's where it all started. Because, particularly, I didn't live in Ireland during COVID. I lived in the Cayman Islands. So,
paradise.
yeah, everyone just had a mask. So the eyes were the only thing you could see,
Mm,
for a lot of the time. And then it made people like zone in on that part of their face. So I think that's where kind of the popularity started to
mm.
grow in terms of eyelid surgery. It's kind of started around then, and now it's just very mainstream, I guess, and almost getting there anyway.
Well, the other rise we saw was double chins because everyone's on their computers.
Oh yeah, true.
They said, "Move that computer up. Take your jawline back." Yeah. But I wanted to say with the last piece is just with patient perspective. So as much as we prepare all aspects of an outcome. I think it's really important because I know you do as well. But photography, even from a personal point of view, as a patient, when you're having an eye surgery or any kind of aesthetic procedure, kind of keeping track of your own outcomes is really important because we see our faces in this day and age between mirrors and phones and social media and all this kind of stuff. We see ourselves so much that it's often others who appreciate our results, and that's why keeping them subtle and keeping your what am I trying to say? Trying to keep your self image in check by photography and by um, videos and things like that.
Yeah, well, I always take my photographs exactly the same spot in the
Mm,
exactly the same kind of location and lighting and everything like that, before and after,
mm.
just to keep it uniform. Um, But I mean, even from a medical legal perspective, it's really important. So
For sure.
patients, when I take my iPad out, everybody thinks, "Oh, is this going on social media?" And I said,
Yeah, yeah, yeah.
"No, no,
No,
this is
no.
just basically."
This is for personal consumption.
Yeah, 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 exactly, exactly. And not everyone. Some people are happy to have their photos online,
Mm,
to show other people from even an educational purpose. But a lot of patients are want to keep it private, and they don't want people necessarily to know that they've done anything. And that's why it's important to have it to keep it subtle,
yeah.
and to keep the changes within the expectation that both I have for them and they have. And I think it's when the expectations are different, that's when sometimes things go awry.
Mm. And to all our patients who do allow us to share, we really appreciate you because it takes courage, and it's
Hmm.
really beneficial to the other patients who are trying to learn about a procedure, trying to understand a procedure, that you allow us to share those. And for those who don't share, we're so happy to keep your secrets, and not
For
even your
sure.
secrets, but to keep your privacy.
Yeah.
It's so and I know Maeve would be in the exact same as me, that you're never under pressure. If you choose to share, that we value that. But if you
Mhm.
choose to keep it private, we're
No, it's
100% with you on that
absolutely,
too.
yeah,
Yeah.
yeah. I mean, personally, I wouldn't like. Well, when I did my laser, I think everyone knew, but
You're on display, Maeve.
but in general,
Yeah.
yeah, in general, you don't want
Yeah.
to necessarily share when you're vulnerable, you know.
Yeah. And so
Hmm.
just as my sign off, see these will be in the hands of Dr. Darty at some time, at some stage in the upcoming years.
But like
Just
just looking at you now, Dallas, for
yeah.
instance, like you have a fullness here, right?
Mm,
That will never change. Like
yeah.
even and with male blepharoplasty, for instance, um, the eyelids are always low. They're all or the eyebrows are always sitting kind of on top. The most you will ever get is like a millimeter or two of a platform show, of eyelid platform show. So and the goal would not be to like take all your fat away and make you all hollow. Like what's that actor that they're all talking about?
Jim Carrey, Bradley Cooper. Yeah,
Bradley
yeah,
Cooper, yeah, that they're all saying
yeah.
like, "Oh God, what happened to him? He was so nice, he
Yeah.
was so full, and now he's all sunken and hollow."
Mm,
So that definitely with particularly men, and there are women too that have a real fullness to this area, and that I can't alter either. That's
mm,
just when you get a little bit of extra, like if you looked at you when you were 18 years old, you probably look exactly the same.
yeah.
Always a little full. So
Like my mother.
that's what gives you the sultry look, you know.
Yeah, yeah. Oh, thank you. But yeah, no, these like it's from my family history point of view. Grandpa had two of them. Mom's had one. Probably needs another one. Sorry, Mom, if you watch this. But it's something because it we be like, sorry, in our family it became problematic because my grandfather, it was pushing his eyelids down and he was scratching his
Ah, okay. Well,
eyes. So
that you're not quite there yet.
no, no, no. I'm just a pup, you know. So, well, thank you so much, Maeve. I really appreciate you taking the time out of your evening and
You're
sharing
welcome.
your wealth
Pleasure.
of knowledge.
You're
Uh,
welcome.
yeah.
Pleasure. Lovely to talk to you,
Oh,
Dallas.
you too. And we'll do this again soon.
Okay,
All
perfect.
right.
Thank
See you
you.
soon. Have a
Bye
good
bye.
evening. Bye, everybody.